EULAR Day 4 and I'm here highlighting another amazing poster, and I'm here with Victoria Harbottle, and she's a physiotherapist from the UK. So Victoria, what are we working on today?
So I'm presenting some work here that was developed as part of the BSPA AHP group, so the Allied Health Group, and it was to develop a core outcome set for use in all paediatric rheumatology conditions for use by allied health professionals.
Amazing! And why are we going for all paediatric rheumatology conditions rather than just say the most common like JIA?
I think because for allied health professionals we always work on the basis of a kind of problems-based approach rather than a diagnosis-based approach. So we always try and look at we classify patients by almost what their functional problems are, and diagnosis isn't always as important to us. So actually we thought that going for kind of across the board would be more useful.
Yeah, sounds great. So how did you go about setting up this core set?
So we're very lucky to have a very active allied health group in the UK, and we first of all started off by looking at the literature to try and pull out which domains are going to be most useful for our young people. We came up with 9 domains. We went away, we literature searched all of the outcome measures out there, so we had a list somewhere near 50. We then sat down in a room for a day. We went through everything. So we were looking at things like whether they were going to be usable in clinic, whether they were going to be easy to access because we wanted everyone to be able to use them. We didn't want anything to be expensive or tricky to carry out. We went through that all, and then we went away and we did a survey. We had a survey online in which people voted for which they thought the best outcome measure would be, or whether they didn't think there was one available. We set a consensus at 60%, and we went from there.
That sounds like a very good method. So what did you end up with in your core set?
So, unfortunately, we only managed to get consensus for 6 out of the 9. And we managed, as you can see, to get consensus for fatigue, school attendance, quality of life, muscle strength, balance and stamina. The other 3 we still think are very important, but we just couldn't find an outcome measure that we thought was going to be usable clinically for us within this set. So yes, we're very pleased with where we've got so far, but it's still a big ongoing piece of work.
And do you think anything else is missing from this set, or is this now a complete list?
Absolutely not. We'd still like to go back to the ones we didn't meet consensus for and see if we can find something else. And we're also aware we're massively missing any measures that kind of capture psychological outcomes for patients, because we know there's a massive link between musculoskeletal problems and emotional well-being for children.
And is there going to be a movement to involve patients in the consensus work, or are we just sticking with the allied healthcare professionals?
So our next bit of work that we've got planned is to work with the Your Room group in the UK, which is a patient group that's based over in Manchester. And what we want to ask them primarily is whether we're capturing the things that are important to them with the domains. I'm not sure how much. I think we will speak to them about the outcomes, but what we really want to make sure is that we're getting what really, really matters to them.
Sounds like an absolutely fascinating and super useful piece of work here. Thank you so much for talking with me today, Miss Victoria Harbottle.